Okay, ladies and gentlemen, we are here with our next Shabbos guest. We're very honored to have Dr. Aryeh Berlin joining us for this coming Shabbos, which will likely be the grand finale of the summer speaker series. So, Dr. Berlin is a child therapist and
Oh,
who focuses on anxiety disorders. And we're very honored to have him this week. And he's going to be speaking several times throughout Shabbos. He'll be speaking at Kiddush. He'll be speaking at a special afternoon lecture for parents and grandparents, and he'll also be speaking at Shalosh Shudas. Welcome, Dr. Berlin.
thank you very much. Very much looking forward to spending Shabbos with you and your Kehillah.
So, Dr. Berlin and I were just chatting earlier, and it seems that he has very deep roots in Long Beach. Actually lived here for a few years himself, and his mother lived right across the street from the show. So, welcome home.
Yes, thank you. Yeah, it's been a bit since I've been there, so I'm really looking forward to coming back.
Fantastic. So, um, your specialty is anxiety disorders in children. What do you see as the most common anxieties? And what, if you just had to kind of give a broad overview of what you're primarily dealing with, what would that be?
Yeah, I would say broadly that there's a tremendous increase in children's inability to tolerate anxiety or emotional distress. So it may manifest in a lot of different ways. You see it in kids that won't go to school because they think their teacher's too mean. Surprisingly, and most recently, I was dealing with a case of a child that wouldn't go to camp because of some social related anxiety, even though we think that camp is so carefree and so much fun and it's like the best part of childhood and the best part of a child's year. There was some things going on, and he just couldn't tolerate the discomfort that came with the anxiety that was related. So it's a broad sort of like inability to be able to tolerate emotional distress would be how I would describe what I'm most commonly seeing.
And is it a modern phenomenon, or has it always been the case, and we're only addressing it and properly treating it now?
Yeah, so that's a great question. That question is asked about pretty much all childhood psychiatric disorders. We hear
Right.
the same question about the increase in autism diagnosis. We hear it about the increase in ADHD. There's certainly an increase in childhood anxiety disorders over the last 10 years. There's been a tremendous uptick. I think that there's a cultural shift that has taken place. I think that there are different parenting styles. And actually, a lot of the research right now, a lot of the pediatric anxiety research is focused on, parenting styles and its contribution to creating, maintaining, accommodating, the a pediatric anxiety disorder. So a lot of treatments actually focus a lot on parenting. And I also think that just in general, as our comforts increase, we physically are taught, culturally, and physically to just constantly seek comfort and avoid, any distress. And we're constantly made to be more and more comfortable. We have, 7 zone, minivans now. Every seat can pretty much have their own, temperature rating. But what the consequence of that and those, that type of lifestyle is that people are not being taught or raised to be able to handle just regular kind of like physical discomfort and distress. So when something presents itself that you can't control, right? You don't have a thermostat on everything. They didn't exercise or strengthen that ability to deal with those types of things.
Interesting. And so what is a typical, just from a high level, obviously, but what does a typical course of treatment look like? A child will come to you, present with some form of anxiety. What's your goal? How does that work?
Yeah. So my goal with treatment is to get them out of treatment successfully. From I say that in session number one. My goal is termination. I really want to get you out of here. Let's figure out what's going on. Let's get an accurate, conceptualization and understanding. The way that treatment typically looks when we're dealing with children, depending on the issue, but there's a lot of collaboration. The beauty of working with children is that I can manipulate a lot in their environment, as opposed to an adult that I can't talk to. I'm not talking to their parents and changing, what goes on at home. I'm not talking with their boss, and well, typically not talking with their boss and changing what goes on at work. With a child, I get to do a lot of work with the schools, with any other, providers like a psychiatrist or even a pediatrician that's involved. And typically 50% of the work that I'm doing is with the parents. I actually always start with parenting work when sometimes that alone is sufficient and I never actually meet the child. Just changing the way that the parents are responding to their child's anxiety sometimes itself is independently effective without meeting the child. And I actually like that the best because I look at it that as the least invasive. The child doesn't even know that they were in therapy.
Interesting. And what type of tweaks do you find that they're over coddling their children? Is that usually the issue, or is it something else completely?
Yeah, good question. So I'll tell you what the research says, right? With the research that's going on right now. If I could digress for a moment before I answer that question, there's been a huge shift in pediatric anxiety research. The old model, the model I was trained in graduate school, was really about that we look at it as a developmental lag that this child has. For whatever reason, they're 9 years old, they're not functioning like a 9-year-old when they're triggered by anxiety, like other typical 9-year-olds, and there's a developmental lag, and it's a skills deficit, right? So we need to kind of figure out what skills they need through cognitive behavioral therapy, typically, and exposure. Well, we could talk more about that, and we kind of get them back. We minimize or get that gap and bring them up to where they should be developmentally. There's been a huge shift. There's really two camps. In general, the approach I take is a more balanced approach, and I agree with both. But there's a very strong research that the focus should be on parenting and what they call, there's really two components to it. One of them is called accommodations. So essentially what happens is that a child will have some type of anxiety provoking situation. And they'll try to, the typical response to avoidance, to anxiety is avoidance and control. So they'll start negotiating with their parents, I'm not going to school today. I'm only going to school today because I don't like Mrs. Morgan. She's so mean. Fine. Then I'm only going to school today if you let me call home during lunch, or if you let me leave early, right? What happens is, from an anxiety perspective, is that little anxiety monster that child has tells the child subconsciously, you see, your parents know that this is dangerous, this is a bad situation. That's why they're saving you from it, right? So even though in the moment, the parent gives in and it's successful because they got the kid to school. At least I got him to school for the full day. Yeah, I let him call 3 times from the nurse's office. The next day it just gets a little bit worse because we fed the monster yesterday. And these are well-meaning parents, and it all makes sense, right? But the parents have to get to work. They have other kids. They have other things going on. They don't have time to negotiate these things, in the morning with the child right before school starts. And it seems to be an effective response, except that it feeds that monster. So that's number one. That's a big component. So what I actually do with parents is I say, let's go through every single accommodation you have because of your child's anxiety. And an accommodation means, how are your behaviors different because your child is negotiating with you, because your child is anxious? Let's list everything. The other part of that is, how do we respond effectively when a child is having an anxiety-provoking episode? So the typical response is something like, it's not a big deal. Everybody's doing it. You find, there's 22 other kids in the class. No one else has a problem with Mrs. Morgan. You're fine. She's not that mean, right? Or we invalidate or minimize it. And in the kid's mind, we may successfully force them, through that power differential as parents to get them into school. But in their mind, they're just saying, my parents have no idea how hard this is for me, right? So we shift that response to more of a validation. I get how hard this is for you, but you're doing it anyway. Right? I mean, that's a very simplistic sort of synopsis of what, a summary of what we do. But essentially, there's two components. It's validation. So I get it. I don't agree, right? Not that I agree with you, but I get how hard this is, but we're going to do it anyway because we're not, Mrs. Morgan's not that bad. Or even if she is, you can tolerate it.
Fascinating, interesting. And do you find that generally, you reference this, but generally are most parents that you work with well-intentioned or well-meaning, or are they suffering from some form of latent issue themselves that kind of translates itself into the way they parent?
Yeah, so that's another kind of research focus. I'd say that they're well-meaning, healthy. Sometimes it's hard for people, understandably, especially with our nurture protective type nature that we have towards our children, to be able to understand that experiencing their distress with them and sitting with them is actually healthier than saving them from it, right? So we do have to sort of look at can we effectively and with stability, emotional stability, respond ourselves in our own emotional experience when our child is flipping out, right? It's very agitating, right? It's very agitating, especially if we're rushed, we're high strung, we got to get out the door and whatever it is. And I don't have time for this, right? And our kid's just having a meltdown. It's agitating, but we do need to kind of like look at how we respond to it so that we don't just fall into the accommodations. But I wouldn't say that it's automatically like when I'm looking at an anxious child, we're automatically looking at anxious parents also. There's parents that respond effectively and still it makes sense from a loving standpoint, right? To accommodate. Now I'm not blaming the parents at all. I actually think that the response makes a lot of sense, but it's not the most clinically effective response. And that's where we kind of like have to shift things. But it's not their fault, but they're definitely part of how we're going to work in treatment.
Interesting. Well, and I think it'll be, if not the last question, the shortly the last question, and this is very relevant to a lot of people at the Young Israel, with respect to grandchildren. So, what role do you see, if any, the grandparents or even great grandparents play in the way their grandchildren or great grandchildren are being raised? Do they have
Yeah.
influence over the home? To what extent?
Yeah. Yeah. I mean, primarily, ideally, and assuming that there's just a healthy family, parental body there, it really is the parents' responsibility. It's a tough one, because it's very hard for grandparents to see their own children raising their grandchildren in ways that maybe are very different than what they think is going to be effective. I really think it depends a lot on the relationship and the dynamic between the grandparents and their own, and the parents of their grandchildren and how they respond. Sometimes it might, like I said, it might be very, very difficult to tolerate it, but they have to consider sort of like the bigger picture. Is my intervention, is the way that going to be accepted by my children, or is it going to be just taken as a criticism and perhaps even backfire and negatively affect my relationship with my children and my grandchildren? And it's a balance. It's something that needs to be thoughtfully considered before responding.
Do you sometimes bring in grandparents together when you do like a group, like a family type session? Are they a component in that or not really?
No, I can't say not unless they live in the home, and they're part of because there can be times, for example, when parents disagree as far as what the response should be, right? And I have to deal with that, right? Because we have to have a unified response. When we're looking at an anxious child, if one of the parents is going to give in and one of them isn't, then the intervention's not going to work. The child's just going to obviously manipulate and go towards the easier, the path of least resistance. So if we have a live-in grandparent and they're also disagreeing and actively involved and accommodating, or if they're overly harsh because they were brought up in a complete, the old European,
Right.
you're going to do it and I'm going to whip you into this and you're going to do it. There's no, like,
Or
I don't know
before
what this.
humans had emotions, right?
Yeah, yeah. So that also might be, it might be kind of like also back to the balance, right? That might be a little bit turned up too much, you know, as far as how it's not presented to the child as a unified, parental and grandparent front.
Very interesting. Very interesting. Well, Dr. Berlin, we're very much looking forward to having you this Shabbos, gaining from your wisdom, insight, and hopefully it'll help us raise our children in a more healthy and productive and efficient way. So thank you so much for joining us. We're looking forward.
My pleasure. Likewise.